Bernie Sanders introduces new Medicare for All bill, welcoming war with insurance industry. Boom. Bernie Sanders on Wednesday is formally introducing, that's today by the way, an updated version of his bill to enroll every U.S. resident in a single government-run health insurance plan. This new iteration of Medicare for All legislation looks a lot like the previous one, which the independent Vermont senator introduced in the fall of 2017. It envisions a government insurance plan that would pay for all medical services with almost no out-of-pocket expenses, making it more comprehensive than either traditional Medicare or employer policies. The latest version of Medicare for All also includes coverage of home health aides, job counselors, and other supports that allow disabled and elderly people to live on their own. Okay, funding for this legislation would have to come through a combination of taxes and fees in lieu of what employers and individuals pay for insurance today, with government regulating the prices of prescription drugs, hospital services, and every other type of healthcare service in order to keep the program's overall cost manageable, according to this article. All right. So here are some of the Democratic senators that are on board with this new bill. Cory Booker of New Jersey says he's on board with it. Kristen Gillibrand, Kamala Harris, Elizabeth Warren of, well, it should say Massachusetts. There's a typo in the article. Uh-oh, HuffPo, I found a mistake. Not a typo, technically, but a mistake. I found a mistake. Now you have to hire me. You have to hire me to do a video comedy segment where I can just say whatever I want. Much like this, except you just give me a salary. In fact, it would be this. It would just be Get Your News On with Ron, but you put it on your platform, and you pay me a salary. Drop me an email, ronplacone.com. Drop me an email. Here we go. All right, so the new bill's out there. Although Sanders on Wednesday will cite independent studies showing, this is from the article, that a Medicare for All system could actually result in the U.S. spending less money on healthcare, those studies assume savings from simplified billing and lower payments to healthcare providers that some experts worry might not materialize as planned. Okay, so the study funded by the Koch brothers, done by libertarian think tanks, which found out that Medicare for All would save us money. Every analysis they did, they actually inflated the cost because they didn't want that result. They actually inflated the cost to as high as their projections could go. So this article, what this article just said in that paragraph, the opposite is true. Studies that were done by right-wing think tanks that wanted to crap on Medicare for All, that inflated the costs of Medicare for All in these projections, they guessed the highest amount possible. Even those studies revealed that Medicare for All saves money, that we spend more on healthcare now than we do in a Medicare for All system. Taxes would be higher, yes, because instead of paying a private insurance company, you would just pay it in your tax bill, but you would pay less money. We would all pay less money. It would cost less, and it would cover everybody. Right now, we pay more than every other industrialized nation in the world, and we get less. We spend more on healthcare in our GDP than any other industrialized country, and we get less for it. Under Medicare for All, it would cost less, and it would cover everybody, and it would eliminate deductibles. So what they said was actually the opposite is true. Oh, they didn't project high enough. No, they projected as high as they could because they didn't want Medicare for All to come out the victor, but it still came out the victor anyway. And when something similar happened here in California, when they scared people away with the price tag, saying it would cost us this much of our GDP if we had the single-payer bill go through in California. That's how they tried to scare everybody, and it worked, unfortunately. What they didn't tell you was we were already spending more of our GDP on healthcare already. We were spending less. They just scared people with that big dollar amount, but they didn't bother saying we would spend a lower percentage on healthcare than we are now as a state. They didn't mention that part. All right, let's see if there's anything else in here. All right, so Sanders is no stranger to skepticism. The new bill is winning praise from representatives of the disability rights community. All right, just kind of... All right, so this is kind of just jargon. Not jargon, but you know what I mean. Many Democrats in Congress aren't ready to support Medicare for all because their donors don't want them to. Most seem to favor at least some expansion of government-run insurance programs, and even the most conservative members of the party's caucus agree on the need to defend the Affordable Care Act gains against President Donald Trump, who recently announced his support for a lawsuit that would wipe the law off the books. All right. So here's a quote from Bernie Sanders. 34 million have no health insurance. Even more are underinsured, and one insurance company executive pockets almost $100 million for a merger which will only drive healthcare costs higher. Please don't tell me this is a rational healthcare system. Amen to that. Just the idea of making human health a profit center is completely irrational and morally bankrupt on every level. But we just accept that as normal here in the U.S. We just accept that as a business opportunity. And by the way, there's not even unison amongst the progressive party that that's a bad thing. Even the more conservative members of the Democratic Party, according to that article, the more conservative members, which means the most conservative members of a largely conservative party. The Democratic Party is, for the most part, a conservative party. There are some progressives in there because they basically have nowhere else to go right now. But it is largely a conservative party. You know, by the Overton window of the world, we have two right-wing parties. One fringe right, one center right at best. So there's not even unison that we need a universal plan. All right. So that's good. This is gaining steam. This is gaining traction. And again, you're noting that pretty much all the presidential candidates are at least giving lip service to it. Beto O'Rourke has Medicare for America, which is basically just more of the, we might get a public option jargon. It's a nonsense bill. It makes no sense, and it's a giveaway to the insurance industry, which is who candidates like Beto O'Rourke are just openly in bed with, whereas at least the candidates saying they're for Medicare for all, they're at least giving a little more lip service to it. Although I question the sincerity in Kamala Harris. She's already waffled on it in the past. She's also done nothing in her state for it. I question the sincerity of Cory Booker because he went against Bernie on the drug bill, on Bernie's prescription bill. Cory Booker, stabbed that in the back. And Kristen Gillibrand, who's just kind of meeting with Wall Street and doing nothing else. And then I don't think, did they say Klobuchar was for it? Let me see if they said if Klobuchar was on that list. I don't think she was, but let me make sure here before we move on. Yeah, Gillibrand, Harris, Booker, and Elizabeth Warren. And out of that group, I think the only likely one out of that group who actually supports it is Elizabeth Warren. She is the most likely out of that group.
Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your